Evening, everyone, and a very warm welcome to all of you. We're honored to be joined by, I see 345 and still trickling in, healthcare professionals, primarily physicians from across the country. Happy Doctors' Day. We're truly excited and deeply grateful to come together for what promises to be a meaningful and thought-provoking evening. The 2026 National Doctors' Day theme, Honor the Calling, beautifully reminds us that medicine is more than a profession. It's a profound commitment to patient care, compassion, and service to the community. Inspired by Gurudev's vision and guidance, nearly a decade ago, Dr. Susmita Jasty, you see her on the screen, myself and many of our colleagues began this journey to support physician well-being for all of you who strive to live these values every day. At this time, I'd like to invite Dr. Susmita Jasty to join me in welcoming you all and to share a few words. Susmita?
Thank you, Sari. Good evening, everyone. What an honor to welcome you to the National Physician Wellbeing Forum. We entered medicine to heal others, pushing through sleepless nights, impossible demands, and personal sacrifices. Because for us, giving up was never an option. But physician burnout is real, and physician well-being is not an option. It is essential. Today is not just a forum, it is a movement. We are honored to have AMA President Dr. Bobby Mukkamala and Gurudev Sri Ravi Shankar here with us to lead this movement forward. Thank you for being here. You deserve this. Back to you, Sari.
Thank you, Susmita. We have an incredible session ahead of us this evening, which will conclude with an interactive poll led by Naveen Kuneru, head of our partnership team. It's now my distinct honor to introduce our moderator for today's wonderful conversation, Dr. Rob McGregor. Dr. McGregor is a lifelong learner and distinguished medical educator, bringing over 40 years of clinical experience and more than a decade of leadership in various executive roles. Throughout his career, he has navigated the many challenges and opportunities physicians face while building a well-being team and creating local solutions to reduce barriers to mental health care. During his tenure as Chief Medical Officer at Akron Children's and in other executive roles, Dr. McGregor became a leading advocate for physician well-being. In that capacity, he co-founded the Akron Physician Wellness Initiative, an innovative program providing barrier-free mental health services for medical staff and trainees. A recipient of many awards, Dr. McGregor now serves as a physician coach for C-suite leaders in healthcare. Please join me in warmly welcoming Dr. McGregor. Rob, to you.
Thank you so much, Dr. Patel. It is truly an honor to be here and to join on Doctor's Day with 1,140 people who registered. Now, that even tells us we've got a fascinating group of speakers, which we do, but it also kind of shadows the challenge that we have in medicine today. If 1,140 of you are interested in this topic of burnout, we have to get together and do something positive to change this environment. With 1,140 people here, it gives us some logistical challenges, even though our talented tech people are here. You can see some of the icons are working, but when things like your hand raises, we don't have the resources to answer that. So if you would raise your hand, instead of raising your hand, please put a question or a comment in the chat. Also, as was already mentioned, we really want to try to create as much of a sense of a community as we can with a big crowd. So we really want cameras on and audio off. So thank you for allowing me to have a little bit of a housekeeping agenda. Now, really to the meat of the topic tonight. I'm very grateful to have a chance to meet Dr. Bobby Mukkamala, the physician in charge of the AMA. He is a board-certified otolaryngologist, and for those of you who may not be clinically oriented, that's a head and neck surgeon. You can see that written here too. He's in private practice in his hometown of Flint, Michigan, and is the president of the AMA. As a passionate advocate for public health, Dr. Mukkamala is deeply committed to creating a more sustainable health system that better supports physicians and more effectively serves the needs of the people in their communities. Dr. Mukkamala joined the AMA's Board of Trustees in 2017 and has been an active member since residency. He's a past Michigan representative to the Young Physician section and a past recipient of the AMA's Foundation's Excellent in Medicine Leadership Award. After completing his residency in Chicago, he returned to Flint to set up a private practice dedicated to addressing the urgent healthcare needs of his community. He shares an office with his wife, physician Dr. Nita Kulkarni, an OBGYN. Dr. Mukkamala previously served as the chair of the Community Foundation of Greater Flint, where he guided his focus on funding projects to reduce the effects of lead poisoning in children. Today, he continues to serve on the Foundation's community board as it works to increase high-quality early education opportunities for children. Sounds like a good pediatrician there, Dr. Mukkamala. He also co-chairs efforts of the CRIM Fitness Foundation to incorporate mindfulness in its efforts to improve community health. And he recently joined the board of C.S. Mott Foundation, headquartered in downtown Flint, but doing work across the world to build a just, equitable, and sustainable society. It's my tremendous honor to introduce AMA President, Dr. Bobby Mukkamala. Dr. Mukkamala, it's all yours.
Thank you so much, Dr. McGregor, and thank you to everybody for having me here today for what I feel is perhaps one of the most important discussions that I've had so far in my year as president about physician well-being. It's an honor to be here with Dr. McGregor and Gurudev in this intersection of so many aspects of my life. The obvious ones are obviously my role as a physician, but also being of Indian descent. So every physician I know, everybody on this call, has a story about a colleague or themselves who has struggled with their own mental health, right? They've quit the profession, perhaps, and some of them, unfortunately, have died from suicide. And that's because of the challenges of what we do. And with nearly 1 in 2 physicians, almost 50% of physicians in the United States are expressing symptoms of burnout, which is why it's such an important topic today. And this is a critical moment for medicine, and not just medicine as a career, but for the health of an entire country. And physicians know it. I mean, we feel that, and with a worsening physician shortage, so we don't have enough physicians coming into this profession, and we have physicians that are burning out early and retiring early. It reduces access to care for the patients, and that's disastrous because of that being a downstream result of our burnout. And so burnout in medicine goes well beyond, simply being frustrated by the demands of our job. I mean, it's a feeling of hopelessness, right? So not just frustration, but frustration that leads to hopelessness and this mental exhaustion that makes it pretty much difficult to provide high quality care to our patients, which is our calling in life. And when that burnout becomes too difficult to manage, physicians sometimes, again, leave medicine behind, which compounds our nation's growing physician shortage, as I said. So as president of the AMA, I hear from physicians all across the country as I travel for 200 days this year about the factors that are driving that burnout, right? The external forces that keep us from being in love with our profession and doing it every day with pride and energy, but instead having symptoms of burnout. And I've seen these up close as an otolaryngologist in private practice here in Flint, Michigan. And the result is basically this: it's becoming harder to do our jobs. And so we're navigating this increasingly impersonal, bureaucratic healthcare system, very different than what the previous generation of physicians, my parents included, had to deal with. And so we're spending more time literally on paperwork or typing into a computer screen instead of focused on our patients. And so we're facing this misinformation and at times even hostility to our profession. This is something that, I felt firsthand when I got death threats for trying to help my community with things like vaccination for COVID. And then, of course, there's the ongoing economic pressures, the payment cuts, the sort of corporate focus on healthcare as opposed to that patient-physician relationship focus. And we're trying to make sense of this rapidly evolving technology like AI, right? So the role of how do we incorporate that into our practice in a way that helps us, as opposed to giving us one more task to be knowledgeable about in a way to sort of, keep up with what's going on. And all of this is, of course, continuing to show up for our patients. And this is just, again, the starting point of all these. And so these pressures, they don't exist in isolation. They're compounding themselves. It's exponential increase. And so they drive this workforce shortage, which increases the burden on those who remain, those who are brave enough to face this challenge despite this headwind, despite the burnout, without our own mental health going strong, that creates a cycle that fuels even more burnout. So the AMA has made alleviating physician burnout a cornerstone of our strategic work for more than a decade, working on a system level basis to remove these common barriers, because it's not going to be unique at this hospital system, different than this hospital system. There's some very common barriers that interfere with patient care and often lead to this burnout and dissatisfaction. So I'm going to talk about some of our work in this space because it's been critical in elevating this issue and making real difference for our colleagues. So in addition to pursuing and pushing for federal policy changes, the AMA is prioritizing physician mental health and well-being. So not just, dealing with Medicare and the finances of our practice, but just physician mental health and well-being with the research and resources, including training modules. So the AMA has something called its EdHub, which is our learning platform, where you can get the science. You can figure out what this experiment shows for my specialty, but you can also get the basics for broader purposes like physician mental health. And so it's important to have this tool in this battle against burnout. And so the AMA has our Joy in Medicine Health System Recognition Program. And this we launched 6 years ago to set basically a national framework for what supportive, effective care environments can achieve. So in 2025, we recognized 109 hospitals, health systems, and medical groups across the country for their dedication to our profession's well-being. And this is, a decade ago was unheard of, right? That there's this focus on physician well-being to the point of getting a silver or bronze or silver or gold recognition for this effort. And so we continue to recognize over 160 organizations nationwide. And so this rigorous selection process demands evidence of system level change, right? So a measurement, there's actually a ruler to measure system level change to keep physicians mentally healthy and able to work and not burning out. And so this tackling this unnecessary administrative task, time in front of a keyboard, championing this team-based care that's led by physicians. So we're not frustrated by seeing what our patients go through when there isn't a physician involved in their healthcare. And then reimagining the role of technology, like I said, about AI to sort of reduce the burden, not to multiply that burden. And so creating and implementing and sustaining a culture of well-being that promotes professional fulfillment. And that's what this Joy in Medicine effort does. And so, with these annual ratings and lists and rankings of all types of healthcare organizations, we created this Joy in Medicine to be the standard by which our nation's best health systems should be evaluated, because it recognizes that those taking the right steps to care for their physicians are the most important and the highest ranking. And so, this is something that we all know, that these solutions must go beyond reducing the administrative burden. We've got to create environments where physicians feel, this safety of seeking help without fear of stigma or professional consequences. And so there's this passage of something called the Dr. Lorna Breen Healthcare Provider Act in 2022. This is something that the AMA was 100% behind and supported, and continues to push for regulatory and legislative and solutions to direct more funding and resources to support our mental health needs as physicians. And so recently, Congress came together in a bipartisan healthcare package, which is pretty unusual to see bipartisan agreement to the point of actually passing something that included provisions that the AMA really fought hard for to continue this effort, a real win for physicians. So we're also working on state and national levels to identify, the reform that's outdated, like the stigmatizing questions that ask about past diagnosis that affects the current licensure. Right? And so we replace those with questions that only ask about current impairment. Right? So if as a teenager I had some issues, how does that affect me when I'm 55 years old practicing medicine and I'm a very different person, not suffering with that anymore? That shouldn't have that stigma associated with it. So the AMA supported lots of legislative victories in multiple states to help create this confidential physician wellness program. So, to date, 40 state medical boards and more than 1,800 hospitals, 1,800 hospitals and systems have audited and changed these very licensure and credentialing applications that promote physician well-being, as opposed to looking for evidence of some remote history and then punishing us for doing that. So we're making progress, but we're not finished, right? So addressing burnout requires this sustained commitment, this responsibility that we share, and continued innovation. And so, we're going to be discussing this shortly in order to face these challenges that impact our ability to take care of our patients, the causes of the problem. This is something that we are critical to promote good patient care and the health of our physician community. And so this is why I'm passionate and grateful to have this conversation, because physician health is an easy to understand aspect of our lives, the physical health part. But now more and more important than ever is the critical role of our mental health and the role that plays not just in our lives, but the lives of our patients. And so thank you so much for this opportunity. It's an amazing experience for me to be here. And I'll turn it over to you, Dr. McGregor.
Well, thank you so much for your kind, heartfelt message on a special day for the doctors here. The sustainability of these efforts is really imperative, and I'm grateful that you've been effective through the AMA to get bipartisan bills passed, which is pretty incredible. I'm going to give a video introduction to Gurudev right now, and then Bobby, you get your breath, get a drink of water, because I'm going to be putting you on the hot seat, so to speak, and give you a list of questions. But if we could show the video introducing Gurudev.
In 2023, Gurudev guided over 1.1 million people in the largest group meditation in United States history. But where does the story start? For that, let's travel back in time and space to a small village in South India and a boy named Ravi Shankar. A boy often found deep in meditation. A boy who told friends that, "I have family everywhere." Even as a youth, Gurudev would spend time in silence. After 10 days of silence and meditation in Shimoga, he emerged with a discovery, a new breathing practice which he named Sudarshan Kriya, or Sky. Since then, Sky has been the subject of over 100 scientific studies, including research at Yale and Stanford. Through Sky, people have released stress and anxiety, let go of the past, and found greater health and happiness. And soon, word spread in India and beyond. Groups grew and people invited him to teach, from Halifax to Argentina and from Oslo to Mongolia. In this way, the art of living began. Now, Gurudev's teachings have reached over 180 countries, touching the lives of over 800 million people. Gurudev started the service projects by taking responsibility for an abandoned school that had no funds. Now, his schools and programs teach over 120,000 students each year.
In my pastimes, I used to hit people and do violent stuff, but now I just don't. I leave it behind.
Soon, he started work in prisons to break the cycle of violence.
Oh, we can't get under CJ's skin anymore. He's doing his meditation now. And I'm like, yeah, you're right.
The movement grew, taking on mental well-being on college campuses, offering support with trauma relief for veterans and their families. Volunteers are building bridges and communities. They're rejuvenating rivers, providing support amid disaster, and transforming terrorists. It's become one of Earth's biggest volunteer movements, even negotiating for peace at the highest levels. In Colombia, after 52 years of civil war and bloodshed, Gurudev's mediation brought a shocking shift. Guerrilla fighters embraced nonviolence and a ceasefire. For his contribution to humanity, countries and institutions have presented Gurudev with their highest honors. When asked about the motto of the art of living, Gurudev often says it's making life a celebration. Gurudev started the World Culture Festival in 2006, turning inner peace and connection into a celebration of the human spirit. All of this an expression of his vision that we are one world family.
And there he is. Gurudev, very nice to see you. Gurudev needs to be able to be unmuted.
Now,
There
can you
he
hear
is.
me now?
Yes.
Hello, Dr. Rob.
So nice to
Happy
see you.
Doctor's Day to all of you.
Thank you. Thank you.
All the way from here from Bali. I think we are 12 hours, no more than that, maybe 15 hours difference.
It's exactly
It-
12 hours
it's
further to East Coast.
East Coast, yeah.
Yes.
Well, welcome. I have the audience has been phenomenal, even with the pre-registration, with the number of questions that they generated. And they'll have to forgive me. They may not recognize their question specifically, but we had to really mix themes together to come up with some composite questions. We'd like to start out with one that's going to both you and Dr. Mukkamala. And it's really the definition of burnout per AHRQ, the U.S. Agency for Healthcare Research and Quality, looks at burnout as an occupational phenomenon characterized by emotional exhaustion, depersonalization, and a lack of sense of personal accomplishment at work. Bobby just outlined many of those things in his introduction. But I'm curious, as two leaders in this space, how do you see burnout through your lens? Is it primarily the system failure or a human energy crisis or some other issues? So, Bobby, you led us off with a definition actually within your talk. So expand a little bit more from your perspective, what you see and how you would define burnout.
Yes, thank you, Dr. McGregor. It's almost identical to what you described. So it's almost exactly the definition that we at the American Medical Association use, and that it's an objective measurement. It's science-based, and it's indeed a system cause. It's not a character weakness, right? Because a lot of people will look at something like this and they'll say, you need to improve yourself. And that's important, right? I mean, it's not that there's a failure in us that causes that burnout. It's an external cause of that, but we also need internal support. We need to be able to face that, knowing that challenge. When I think about the medical students that are going into our profession, right, that's their calling. They approach it knowing these headwinds. And so one issue is dealing with those headwinds, and the other is preparing for those headwinds. Right? And so that's something that the American Medical Association is very passionate about. Of course, when there is a challenge like the healthcare system, we're going to work to fix those challenges, but also must help physicians maintain their own mental health. And it's that health that we need to work on so we're not as vulnerable to these headwinds. I don't want people to be dissatisfied with their calling in life. Right? When I think about taking care of a head and neck cancer patient, that should be my only challenge, not the challenge of asking an insurance company to authorize getting a scan to figure out whether this cancer has spread. That's not the challenge that we should face. But when we deal with that, there's a moral injury. It's not, a lot of people use that term instead of burnout. It's a moral injury when I'm trying to take care of my patient who has a life and death situation, and I'm challenged by a system that doesn't help me. And what's the consequence of that? Not just the physical health of my patient, but the mental health of their physician.
Thank you. Gurudev, I know from prior meetings that you've dealt with people, millions of people across multiple high stress environments. So how has that shaped your opinion about the lens in which you see burnout? And give us a little insight as to what's really happening within the physician who is burning out, things that are beyond what metrics the bean counters can look at.
No, I agree with what Dr. Bobby just mentioned. Burnout simply indicates the load of work on a person. It is not a sign of weakness or being vulnerable. It's more the pressure of work. For me, stress is when you have so much to do and so little energy and no time. That causes stress. So when you have to achieve things in a short period of time, when you're on your toes all the time, that causes you more stress. And of course, doctors have to be on their toes, that it's a question of life and death for the patient. So they need to be very alert, focused all the time. And this definitely drains the energy, and we are not recuperating that energy. This is where we need the wellness programs for the doctors, where they can recuperate the lost energy in the process of working. Now, one more thing that is really impacting the world is we have so many other things to do other than the work. Social media, and then, bombarded with so many of those images and impulses and load of work that takes a really big toll on our health. These things have not been addressed as it should be. That's what I feel. So that is where the burnout appears to be even more prominent and more visible than what used to be before.
Well, thank you both. I think we see what the definition is, but we also recognize that there's two components. It's an us component to be the best we can be, even if that means we need help. This is not something that you have to travel alone, and that's part of establishing community here. But there's also some of the systemic things that we need to work with, as Dr. Mukkamala said about artificial intelligence. It's great if you can have a scribe allow you to recover time from looking at your patient and not having to remember that it was at the left or the right, and now you're up at 2 a.m. trying to finish a note and make it accurate. But what we have to do is find a way to convince, and I was part of the C-suite, convince the CFOs not to translate those extra moments into 5 more RVUs, but to translate it into more meaningful patient encounters. Any comment, Bobby, about how we can, I mean, the C-suite has its budget. I know they have their metrics. I was part of that a year ago, and I'm not sad to leave that behind. But any ideas as to how we can have a carrot not turn into a stick?
Yes, this is something that, I mean, it's a great question. I think about it, we used to hear a lot, we still hear a lot about no margin, no mission. Right? It's like, if we don't have the math, we can't do what we are here to do. But I have a little bit of concern about that statement, right? We should be mission focused. When we all look at the compass, we should all see the same north, which is the improvement of the health of the community that we serve. And so when people in the C-suite are just looking at the finances and not setting north on the compass as the health of the community, I see the consequences of that all the time. Right? When I drive down the expressway, we have I-75 that goes right through my town. All the billboards about healthcare are about where to get your hernia fixed, right? Where to get your stroke screened, but nothing about prevention of disease, right? Because the system, the finances, don't support preventing these negative consequences to our health. And so that's something that I think is very concerning. And I'm glad that we're starting to pay attention to preserving health, right? And not just physical health, but mental health. And so that's where I think we need physicians in those C-suites, right? So much of the tendency and the trend is to sort of make physicians the pawns in the chess game of the health system. Nobody's closer to patients than physicians. Certainly not the people in the C-suite. And so we need to be in the C-suite. So we are the messenger. We are the people that share with the planning about what our patients are going through.
Well, thank you. Thank you very much. Gurudev, one thing that's come up through the questions is that dealing with patient death or failures in a patient encounter, whether it's a misdiagnosis or some other error, and and grief. Those are three subjects that not only get ignored, but they've actually been suppressed or repressed through medical education in the U.S. Until very, very recently. And I'm still not convinced that we've made a whole lot of improvement there. But how would you advise physicians, especially those in the beginning of their career, to effectively cope and manage and actually grow from these experiences?
Every experience in some way contributes to the emotional stability or growth of a person. So whether it is at home or in profession, what is needed here most is to see it from that perspective, from a larger perspective of how things are, and that needs some sort of clarity in the mind. When we are stressed so much, our perception takes a toll of it, you know. So we need to see a position or a place or a situation. It needs a lot of inner strength. And the inner strength cannot come to a person if they are overworked or burnout or very stressed. This is where exactly I would say they need to take some time off and take a good walk and do some exercises. And meditation will be of great help. Meditation to me is like, pressing the delete button in your computer of what those things which you don't want. So those data, you have to put it aside. So that gives a fresh energy. We usually say for a common person, there are four sources of energy. The first one is food, second is sleep, third is good breathing practices, that can, that is so linked to one's emotion and state of mind. So there is a link between the state of mind and the breath, which has been ignored for a long time. Other than when people get into the MRI machines or CT scans, they take a deep breath, hold, and then you can breathe normal. This is the instruction that is given. But asking patients or even for the doctors, I would say, to take few deep breaths now and then and, feel more fresh and draw energy from the breathing process itself is been missing. Then the fourth, I would say, is a source of energy that one gets when the mind is totally relaxed. A conscious rest is what I would call as meditation. In sleep, you get a deep rest where you are not conscious. But if you keep your mind conscious and then also relax, that type of rest seems to be impacting a lot of our uh, people in a very, very positive manner.
Dr. McGregor, if you wouldn't mind, just if I could add to that.
Certainly.
Thank you. So in Flint, Michigan, just like Gurudev said, Flint is a very challenged city in the United States, right? Post-industrial, General Motors used to have 80,000 jobs here. Now there's 8,000 jobs, a lot of poverty. And we have one public school that's a very challenging place to get an education. And then we have the Flint water crisis that you mentioned, Dr. McGregor. So all these headwinds in every classroom in Flint Public Schools from kindergarten to 8th grade starts their day with a mindful moment because of the challenges they had up until the moment they walk into that school. Unless you pause and spend, kindergartners, maybe it's 10 seconds. 8th graders, maybe it's a minute or two. But if you spend that time just focused on what it is that you are about to do for the next 8 hours, it is helpful. And so not only was it in the schools, now it's in law enforcement. Now it's in the healthcare system for exactly the reasons we're talking about today. And so just that the pause and realizing that there's more to our health than just the physical health. And then there's a lot of comments I saw about lifestyle medicine. And just as Gurudev said, it's the right amount of sleep, it's the right diet, but it's also stress reduction that has a physical consequence. When we have less stress, we are physically healthier.
And emotionally very robust and strong also, if I can add.
That's right. That's right. Well, one of the questions that's kind of related, that's come up a lot in our survey early on, was as healthcare professionals, we understand that we need to be responsible for things when they don't go well, even if it's part of the system and not necessarily surgeon error. How do we balance taking responsibility from and being consumed by guilt? You know, as a coach, I see a lot of docs that their issues stem from perfectionism and the fact that they cannot possibly measure up to what they or society they perceive has placed on them. So how do we help our folks here balance owning the challenges, looking for solutions, and keeping guilt in its perspective? So Bobby, why don't you start with that? Your mic was hot, and then I'll get to Gurudev.
Sure, sure. It's such an important question, Dr. McGregor, because I mean, I myself in my own practice, this is my 26th year in practice. Not every case that I do surgically turns out perfectly. Some of them far from perfect. And the stress of that is exactly like you said, right? When you have a patient that you're operating on to improve their hearing, and there's a complication of surgery that causes permanent deafness. Now, that's just one example, but it's me as an otolaryngologist is something that could happen. And you do enough of those over 25 years, it's going to happen. And it is so stressful, just like you said. I mean, I thought, why would I ever do this operation again? Even though 99% of the time it's fine, right? There's so much, concern and stress about that it is just not good for mental health. So what is the solution for that? So what should we do? I think this is something that peers, right? Those of us that deal with this on a regular basis should help each other, because we tend to silo that, right? That's the last thing that would come up in a conversation about something that went wrong in my practice, right? It's like all of a sudden you don't talk about that stuff. That's not a good environment. That just, if it stays here instead of being expressed here with my colleagues, it does damage, right? And so I think the best way to deal with that is with our peers, right? And the problem is, and I know you know this, there's a litigation consequence that creates this environment of a lack of willingness to talk about it, right? And that's a problem. The environment should support all of us, right? Especially with the physician shortage. If I stop doing that operation, who's going to do it in Flint, Michigan, right? The patient has to travel to get that done. It's bad for healthcare to not take care of physicians that suffer these mental consequences of what's going to happen, complications.
Thank you. Gurudev, I know you were ready right out of the gate here, so I'm going to give you a shot.
Yeah, I was reminded of a story that said by an Ayurvedic physician. He said God loves twice, in two occasions. When a doctor says, I'm here, I will heal you, I'll cure you, don't worry. When doctor gives that assurance, God has the last laugh, it seems. And then two brothers says, this is my land and my land. They fight with each other. Then also is the occasion where God has a big laugh. So perhaps this story would help doctors a lot, that you do your best, but then you leave rest to the nature, to the higher power, and it knows, in spite of all your effort, if things don't work, you don't have to feel guilty, because your intention has always been to do the best, and you have done best. If you have been tired, if you are not being very mindful, whatever you are doing, then you need to do something to increase your own energy level. As I said earlier, few minutes of taking time for meditation, some deep breathing and relaxing before you start on any job, whether it is in the profession of Medicaid or even in the air traffic control people. This is very essential because, someone is sitting in the control tower. If they doze off even for a few seconds, they are going to cause a big damage. So the energy level there also, like that, the person in the control tower, doctors need to take care of their own emotional, mental, and physical health. In India, I was told about 65% of doctors have got a lot of issues, health, they're not in the best of their health. So in this case, we need to really attend to what Dr. Bobby had already mentioned, wellness programs for the doctors. They need to take a few days in in a year, or just a few days, even I would say in a month, to energize themselves so that, mindfulness is not a practice. I would say it is a practice. I would say it is a result of a practice. You can't try to be alert all the time because that is a tension. If you try to be alert, it causes a lot of tension in the mind. But if you had a good rest, automatically your attention span is sharper and larger. Today, because of all this media and all the workload we have, our attention span has shrunk to 30 seconds. Can you imagine this? I mean, the psychologists say today's attention span is only 30 seconds. So it's necessary to increase our attention span, and that can happen not by an effort to keep your mind very alert all the time, but to do the opposite of it. Relax more and uh, de-stress yourself, then your attention span spontaneously increases, and you are able to be more mindful.
And then
Thank you.
one more thing, Dr. McGregor. So Gurudev mentioned, the time away from our work to lead to this better mental health. And I think that, like we do in the classrooms that I mentioned, even on a daily basis, instead of a whole day off to do that, even a few minutes per day to orient us on what we need to do, what we want to do, and focused on that is important. So not working super hard for 1 week only to take a day off, but to actually embed that mindfulness and the good mental health goal within each of our days.
Absolutely. Few minutes of meditation every day. I often call it as a mental hygiene. Like you have dental hygiene. I say it is mental hygiene to do a few minutes of meditation every day.
Well, hopefully we'll have enough time to get to a couple questions about that. But one thing I want to shift it a little bit for you, Dr. Mukkamala, excuse me, Dr. Bobby, as you're leading the most powerful medical organization in the world, you've also had to face a brain tumor diagnosis yourself. We cleared this with your office, and for those in the audience, this isn't a HIPAA violation. Dr. Bobby saw the questions, and he's okay with it. What was your biggest learning on the other side of the doctor-patient relationship? And have any of your AMA priorities shifted because of your experience?
Yes, this was having this brain tumor diagnosed just a little over 1 year ago, in a large brain tumor, an 8 centimeter grade 2 astrocytoma. Has about a 10-year life expectancy just based on the data that's there. And you would think that after that it would be distressing for the rest of my life. But honestly, I can say that within a matter of 24 to 48 hours, I didn't feel anything but privileged. being here in Flint, having half a dozen consultations with the best neurosurgeons that only work on gliomas, from the Pacific to the Atlantic and institutions in between. And then within 3 weeks to have that operation and then be able to get back to work as president-elect of the AMA within 6 weeks, that is nothing that any of my neighbors or anybody else in this country would have that kind of access. And that's when I realized that, yes, the AMA has a lot of things we work on. Physician burnout is one of them. Medicare compensation is another. Prior authorization is another. These are all the things that we work on. Every president, these are our priorities because they're so important. But for me in particular, access to care for everybody in this country became my priority, right? When I see that we spend $4.5 trillion per year on healthcare, but on so many things, we are mediocre at best, right? Like mental health issues, like pre-diabetes, preventing it from turning to diabetes. We're a failure in so many measurements like that. And so that's when I realized that for me to make it through this and have this benefit of this kind of access, that my goal is to try to improve access for everybody. Those that don't have insurance, right? Those that have the number one cause of bankruptcy in this country is medical debt, right? This is a system that needs improvement, not just for our physical health, but our mental health. When I think about the challenges that patients face dealing with it. So that's why I saw this as a blessing. It seems weird to say that my 8-centimeter brain tumor was a blessing, but I can honestly say I can't help but see it any other way.
Well, thanks for sharing intimate moments of your life. And I see by your countenance that there really is a sense of peace about that. For both
And you
of
have a
you,
very good smile. You have a good smile.
for both of you, being a practitioner of sky meditation myself, I and thousands of healthcare providers across the world have experienced transformations. But most clinicians, and it took me 3 invites before I accepted, are resistant. Most of them need to know that it's evidence-based or evidence-informed, that it's time feasible. I can squeeze in that half hour before my day. And it's integratable into my daily routine, whether I'm mindful when I'm scrubbing or when I'm mindful when I'm about to open the door for a screaming 2-year-old. How do we help actually address implementation of such programs within real world healthcare systems? You mentioned you did it with the public schools in Flint, for Pete's sake. We should be able to do that. What evidence would support integration of holistic programs into our institutions? And I want both of you to talk about that.
You want me to go first? Yeah.
Gurudev?
Yeah.
So how would you advise Rob McGregor as he's going back into the C-suite, which he's not? My wife's here in the program, and I don't want her getting upset. To really reframe things for the C-suite.
We should just go with the flow. Someone comes and screams, and you get a phone call, but we don't mind any disturbances. Because if we get disturbed about the disturbances, then we cannot relax at all. We should embrace this moment as it comes to us, and the great sense of acceptance of the current situation can relax us much more than anything else. But at the same time, we make sure that we get at least 10-15 minutes of our own time. As I said, like we always find time to brush our teeth, and personal hygiene, we do take time. In the same sense, if we incorporate few minutes of for ourselves in our daily routine, just before having a meal, or as soon as we wake up in the morning, few minutes to consciously relax and meditate. meditation has been proved beyond doubt, where many evidence-based research point to that it really brings much needed relaxation and rejuvenation to our whole system.
Thank you for that thought, Gurudev. I'm going to ask you, and it's come up in the questions, after we let Dr. Bobby answer, I would really like for you to take this team through a brief meditation. So if I could ask you to indulge us, but first I want Bobby to give his response to how do we create a funding or put pressure on the C-suite or what you've got some ideas. I can tell by that your posture.
Yes. So this is one of the main priorities of the American Medical Association, to prevent burnout. And so this is an investment that we've made to answer exactly that question. And I would say it's something that I mentioned in my introduction, this joy in medicine effort that we have. I think it's a wonderful name to describe all of our efforts, our investment, our financial investment in trying to help people within a system seek the system to change the way it works, right? To be a place where they pursue joy in medicine the same way we do, because certification, recognition for being that kind of environment is amazing. And one thing that Gurudev reminded me of, I grew up, my parents took me to Swami Chinmayananda's camp as a kid growing up, all the way from when I was 5 years old into the 90s when he passed. And he used to have a BMI chart, body, mind, and intellect. And so when our mind, in the middle of the challenges that we face on a daily basis, becomes emotional, becomes anger, becomes frustration, it's our intellect that should recognize that and suppress that, right? Sublime that. And so that's something that I think in those moments, I wouldn't want to be waiting, because just today in my office, I had a patient with cancer that was struggling to find the finances to meet their deductible. And there's anger in that situation, right? But instead of anger being the solution for that problem, which will get us nowhere, it'll make me affected when I'm seeing the next patient who has no idea what's going on. Maybe some kid. This anger shouldn't have a consequence over here. That's where the intellect should help us to say, okay, this is how I'm going to deal with this. Let the emotion be something that we observe, but we don't fall prey to that emotion. The intellect should supersede. And I think that's a wonderful way to deal with these challenges, in addition to externally, right? I think a lot about it with, like Mahatma Gandhi, right? So nonviolent, but put up a fight, not with violence, right? But with all of the other effort. And that's what I'm excited to do.
Before we move on to Gurudev's, I hope I twisted his arm enough to take us through the meditation. There's one question that the team really thought we should ask both of you, and it's theoretical, but it probably would happen if we opened up the sound. Imagine there's a physician in this room or in this meeting today that grabbed you on the side and said, I think I'm leaving medicine. What would you be able to tell this person as a reason to stay? What will we look forward to? What policies are coming down the road? And then finally, after you both wrestle with that, we want you to think of one message you want to share with doctors worldwide on this Doctor's Day. So, how are you gonna talk me off the ledge here, Bobby?
Well, Dr. McGregor, the first thing is to ask why, right? What is it? Because sometimes that's the stress outside of medicine, right? We shouldn't assume, even though we know this job is tough, that this colleague's stress comes from their work versus their personal life. We need to, if it was a patient of mine telling me that, I would explore, I would get the history, right, before coming to the assessment and plan. But if indeed it's because of frustration with the profession, with the frustration of trying to take care of their patients, I would get to the specifics of that. What is it about their environment? Is it the place where they're working? Is it the insurance company that is so frustrating because of something like prior authorization? And then I would explain to them how we are trying to help, so they don't leave the fight, they join the fight, right? because that's what gives us purpose. When I talk to my colleagues, so many of my colleagues, instead of my parents' generation that worked until they couldn't physically work anymore, the majority of my colleagues are now working until they can't mentally work anymore. But how do we solve that? We identify the challenges. And when you're in a battle, you don't give up. And that's what we try to convey. Join the battle, right? Join this fight to improve our mental health, to decrease the chance of us burning out.
And maybe that battle will give us that 20% of joy we need to step past, if we believe Tate Shanafeld's work. Gurudev, but how are you going to talk me down?
I come across this question so very often with the students in the first or second year of their medicine. They say they just want to leave medicine and join maybe engineering. The other shore always looks more greener than where they are. So with great difficulty they get into medical profession, and in a year or two they get into. For them, I would always say, well, postpone that for some time. You are wanting to leave your profession. It's not going to help you in any way. Just now recuperate yourself. You are in high burnout. So I would ask them to take a few minutes of meditation, do some breathing, spend a little time in the nature. When the mind becomes very clear, free from frustration, then take decision. Say, a decision taken in a frustrated state of mind will only lead to more frustration than any satisfaction. So I always suggest them to calm down and have more clarity and feel more happier. In a happier state, any decision will always create more happiness in the future. So, and people have found that very useful. So they sit for a few minutes of meditation, they do some exercises, and then they come and say, no, I was so stressed out, I was so frustrated, but now I'm okay. Now I'm ready to go ahead. So this is a common phenomenon these days. And among the physicians, I haven't heard that with practicing physicians as much as I've heard from the students or the interns who are upcoming physicians. Yeah.
So, and to finish up the questions with you, and then we'll go with the meditation. What's a pointed message that you want to share with the docs here nationwide on Doctor's Day?
You are very precious. Please remember this. You are here not just for yourself, but for the whole society. The society needs you. And so do take care of your health. When I said health, I'm not talking about you eating well or sleeping well, but I would like you to take care of your mental and emotional health as well, and uplift your own spirit. I would say the spiritual health is when you have an undying smile on your face, in which you feel, see beyond, the emotions, the mind, and look into the consciousness of which we are all from. The Scientific American has written a lot about consciousness, and little time in dwelling on the science of consciousness will also give you a lot of energy that you would need to be very happy. I would like you to be a very happy Doctor's Day, not just one day, but every day. I would like you to be happy on a daily basis. And the way for it is take care of yourself, do whatever is needed for that.
And we have Dr. Bobby's great smile throughout that. So he's emphasizing that. Dr. Bobby, one message, and then we're going to move to the meditation. And we have a fun poll for all of you to take on your way out of this, to make sure that we can meet some of your needs after this meeting. Dr. Bobby, what's your brief message to us?
Thanks, Dr. McGregor. I guess what I would say is that There are some things that are short-term problems that we at the American Medical Association can fix in 1 year. And that deserves our effort and that deserves our energy. But there are many that will last for a generation. And for that, if we don't embrace our own mental health and work on preserving our own mental health so we don't burn out, then we will not succeed in that, right? So it's all our approach to long-term challenges and short-term challenges. And for long-term challenges, we need good preservation of our mental health. And exactly this conversation is how I hope to spread taking care of our own mental health so we can stay in those battles to improve healthcare for longer.
Well, thank you both so much. Gurudev, do you have a moment that you could at least tease us with a little introduction to meditation?
Yeah. I'll give you just a few points about meditation. And I've made number of guided meditations. You can just go into the YouTube or, in the app, and you can download them. The first point of meditation is it should be effortless. It's not sitting and thinking or imagining anything. So the first principle I would say is do nothing for a few minutes and want nothing. Say for 10 minutes, I want nothing. That would help you to relax more. Wanting something can keep us in an active realm. So in order to relax, you say, I want nothing now. So it cuts your that activity trend to do some activity. So I want nothing, I do nothing, and for a few minutes I will say, I am nothing. Getting free from the identities that we hold on to, because even that is a stress. When we hold on to our one identity, it can not let us relax deeply. This is one thing. Second is we blink our eyes, not only when we don't know the answer, but even otherwise. So, and we breathe. If you synchronize your eye movement with the breath, you will feel instantaneous relaxation coming to your own system. So you breathe in with eyes open, and as you breathe out, you close your eyes. If you do this 5-7 times, you will feel that it is already relaxing you. So synchronizing the eye movement and our opening and closing of the eyes with the breathing in and breathing out can also help. And again, as I said, sit comfortably, easily with spine erect as possible, your head not rested but free, because when you rest your head, you have a tendency to fall asleep. So meditation is again deep rest, but without falling asleep. If at all you fall asleep in spite of this, that also we don't mind. It can be part of it. So these few exercises will help. Also, another one I would say that would help is you breathe in with your hands up and you breathe out, and consciously link your breath with the physical movement. Body, breath, and mind getting into a rhythm can bring a lot of energy and release a lot of stress. So with these few words, I leave you to some meditation that you can continue now. And in Bali here, I have to go for a session now. Here. All the best, and it's so wonderful being with you all.
Thank you so much to both of our speakers. Before we get this poll going, I don't want to lose the crowd, but boy, this was, I'm very grateful to have had the experience to be in the same room with both of you. I wish it was in person, but maybe next time.
Next time.
Thank you.
Thank you.
Bye. Bye, Dr. Bobby.
Bye, Gurudev. Thank you.
Dr. Rob, bye. Lovely.
At this point, I'd like to ask Naveen to come on camera. Naveen is really one of our fearless leaders here, and he's in the head of partnerships, and he's going to help us wrap this up and collect this data that we want to get so that we can help you start your next step of your journeys. Naveen?
Thank you. Thank you, Dr. McGregor. What an honor to be on this forum with Gurudev and Dr. Mukkamala. Thank you so much for your continued leadership contributions, Dr. Mukkamala, for what you have done and what is to come, and to Gurudev for his incredible vision and really making our planet so beautiful. From this inspiration, Rob, I think it's a great idea to see how we can invite our colleagues or audience to see what they would like to do in their next steps of the well-being journey. So what you will see on your screen now in just a minute is a quick poll on how you want to take responsibility and inspiration in your own well-being. Camilo, if you want to start the poll, please. So go ahead, and there are about 4 choices in there where you have the choice to be able to make a commitment to take care of yourself, and if you're far enough in the well-being journey, to want to bring well-being to your colleagues or organization, and if you're interested in taking it further over to your patients, so that's another great opportunity as well.
So with the results of this, we will be able to customize communication for you individually with some opportunities to take the next step in your wellness journey.
You're absolutely right, Dr. McGregor. So we in Healing Breaths are very committed to ensure that we support your well-being. So please, for any of the choices that you choose, be assured that we will follow up with you for that path that you're choosing. And it's really, really encouraging to see the numbers that are racking up here. I think what has started here is honestly a well-being movement, what started as a forum. So we're very, very excited, and we invite you to join the well-being movement. And as a part of that, to support you in your journey, we have programs lined up in April and May. In April, we call these as the free weekly starter kits that you could do well-being for yourself individually or your organization, or incorporate it into your patient care. As we mentioned, we'll follow through with your responses. And we say Shine in May, where we have immersive well-being retreats. Hint, hint, they're all CME eligible. So with various programs that we can offer for you. So we really look forward to your responses, and please stay tuned for follow-ups from our end.
Dr. Mukkamala is still with us here. Very grateful for your participation, especially sharing some of your personal journeys. And we wish you nothing but the best. And I'm sure you'll be very, very productive in the next few efforts within the AMA.
Thank you very much, Dr. McGregor. Appreciate it.
Thank you. Thank you so much, Dr. Mukkamala, for everything you have done. And we really, really greatly appreciate for you to take the time to be here amidst travels, amidst surgeries. And what an honor on a doctor's day. May the work that you're doing and your message shine through for all of us. And we're in this together to take this forward. Thank you so much. Dr. McGregor, thank you for being an incredible leader, a leader who walks the talk. We've seen you have embraced well-being personally, individually yourself. You've brought it to your organization and community at large, as you're doing as we speak. So thank you for doing this here as well. And to all of you who are here, happy Doctor's Day. And as the theme of this Doctor's Day is to honor your calling, we're here to also share you're not alone in your well-being journey. And it is certainly not selfish to take care and do self-care. So we're here for you, and we would like to be with you in every step of the way, wherever you are in your well-being journey. So thank you so much. And let's keep this movement going as we just got started.
While this forum is ending, this is an inspiration for all of us to move our collective work forward. and transform healthcare as we're experiencing it today.